and we want to welcome you today to our press conference. This is one of the first press conferences that the legislators are having since we were quarantined. So in keeping with the spirit of the guidelines, we're going to limit our speakers today, but that doesn't mean that every single legislator here is not passionate about this critical situation within our nursing homes. And that's what we're here to discuss today, the long-term care facilities, in particular, the nursing homes. 2,500 residents of nursing homes tragically lost their lives, which made up over 60% of the deaths in Connecticut. A lot of the legislators called upon Governor Lamont to evaluate and look for an independent review of the nursing homes, and we're very grateful to the governor that he's taking that critical step. The RFP came out on Friday, and we took a look at that, and there's a couple of aspects that we're appreciative of. One is the timeliness of the results of the report, with preliminary results coming to us in August so that we can prepare for a potentially dangerous second wave. We appreciate that the report is coming to the legislative leaders as well as the administration so we could look at any legislative action that needs to be taken timely. And we also appreciate that the independent review not only looks at the preparedness and the response of the nursing home industry to a pandemic, but it also looks at the preparedness and response by the state agencies to a pandemic. And we think that provides for a complete, honest assessment. We know that nursing homes have been fined, and we look forward to learning more from this review to determine if there's any more accountable actions, what those ramifications by the governor's office will be. As far as what's being specifically reviewed in the independent audit, there was some areas that were identified in the RFP, but through our working group with our Women's Caucus, we identified some areas that we would also like to see reviewed in this independent audit. And we're going to share those aspects with you today. But before we do that, I would like to turn it over to my co-chair of the Women's Bipartisan Caucus, Rosa Rembimbas.
Good morning to everyone, and thank you for taking the time to be here. And certainly, as my co-chair just indicated, there's many, many more of us that would have loved to be here, but either as a result of commitments or, again, we encourage them with social distancing, that their voices would be heard even though that they weren't here present. So as co-chair of the Bipartisan Women's Caucus, I'm proud to be here jointly with everyone to show that we can come together and work together to get things done. This is an issue that does transcend party lines. We have members on both sides of the aisle that have identified questions and issues that need to be addressed related to the nursing home and all their types of facilities. We have communicated those to the governor, and again, we thank him for taking the next step of making sure that there is going to be an independent review. Now we need answers to those questions. We need to know what happened, what worked, what didn't work, and what could we learn from it. We also need to analyze what was the chain of command? How did the chain of command work, and how can we improve on it? All the way from the governor's office to the commissioner's office to all of the respective department heads, and who were in charge and what type of charge was taken place. We need to ask what was known, what was done, and what needs to be done for future pandemics. The timing to address these issues and questions is critical, so that we could be prepared. This is not over. We need to gather the knowledge and the support that's absolutely necessary for these special workers. We need to make sure that our loved ones and constituents who currently still are in the nursing homes and other types of facilities are being protected. We need to make sure that we provide them with everything that they need. And again, I just wanted to take an opportunity to remember those who sadly we have lost and keep their family members in our thoughts and prayers. And we want to make sure that those family members who still have loved ones that are residing in these facilities, that they know that we're here and we're going to take action and we're going to make sure that we do everything possible to protect them. Again, thank you for the opportunity to be here.
And now we'll hear from our Majority Leader, Matthew Ritter.
Thank you, Dorinda and Rosa, for your leadership efforts on this caucus, and Governor, thank you for joining us. I'll just say, for our caucus, it's been very personal, and I would say, for the entire legislature. We've had Representative Cook, Representative Miller, Representative McGee, Representative Vargas, and I could probably think of more, and I apologize if I'm leaving anybody out. Let me just take this off for 1 second. It might be easier to hear me. Who have lost loved ones to COVID-19, some in nursing home facilities, some outside of that. So just like it hit so many families across Connecticut, it hit us. And I think this review is not to point fingers and cast blame, although we may find at times that there were some folks who did not act the way they should. We're also going to find courage. We're going to find workers who went in March, in particular in April, without adequate PPE. We're going to realize how much the failures of the federal government impact all 50 states in this country. So we have a busy special session in July. Many of you know we'll be voting on police accountability and the absentee balloting laws to make it easier to vote in November because of COVID-19. Those are two major issues that are going to happen in the next couple of weeks. Outside of that, though, is the time needed for the review of the nursing homes, which I think we'll be due in the fall at some point. And there's other issues like that are percolating. The legislature will be very busy, but we've been very fortunate to have the governor run the state the way he has in our absence, and we look forward to getting back and working with him. Thank you very much, everyone.
Thank you, Majority Leader Ritter. I'm going to now introduce a representative who has been, sorry, Channel 8. A representative who has been spearheading a lot of the nursing home initiatives and review through interviews and meetings. Not only is she a great legislative leader, but has a personal story to share. And just by way of background, when the pandemic was unfolding and everybody was finding their new norm and working virtually, the Women's Caucus was no exception. We continually met through Zoom. We were identifying areas that were important in the state and determining what we could do to address those areas, broke out into work groups, with nursing homes being a top priority for us. So Michelle, Representative Cook, is here with her working group that reviewed the nursing homes. And as we said, these are areas that we want to be included in the RFP, but also looking forward to long-term review of our nursing home and how we could do things differently so that no other lives are lost in the future. So with that, Representative Cook.
Thank you all for being here. I'm going to ask my friend and colleague, Representative Abercrombie, to hold a picture of my father-in-law. This is part of the reason why I stand in front of you today. I would like to thank you all for being here today. I would like to personally thank all of those healthcare providers for all that they continue to do to care for our residents during the COVID pandemic and beyond. There are sacrifices and loss being felt across our state and across our country, and that is exactly why we are here today. Please bear with me as I share with you my family's personal story. This is my father-in-law, a Korean War veteran, William J. Cook, Jr. We call him Pops. Pops turned 90 on March 24th, 2020, and entered the hospital on Sunday, March 29th. He had been in a nursing home for almost a year. He had been in the same unit the entire time until the weekend of March 27th, when we received a call that they were going to relocate him to a safer floor in the facility. This was the beginning of the end for Pops. Within 36 hours, Pops was sent to the emergency room, having difficulty breathing and running a temperature. We thought many things, but we did not think COVID. We were told that there was no COVID in the building. The interesting part, when my father-in-law entered the emergency room, the nurse told my husband that in fact there was COVID in the nursing home that Pops had come from. So now we wonder, was COVID in the nursing home? Did the hospital know? And did the nursing home not know? How could this be as the homes were locked down for almost 3 weeks prior? How did COVID get there? Was he the first resident with COVID? How could this be possible? Within 24 hours of Pops' admittance to the hospital, we received the call that no one wanted. We need to place Pops on a ventilator as he is having difficulty breathing, and they feared that he would have a heart attack if his breathing labored any worse. My husband talked to his father that night, explaining to him that everything was going to be okay, that they were just going to help him breathe so he didn't have to work as hard. And Pops reassured us that everything was going to be okay, but it wasn't. He feared of getting COVID. He knew if he got it, it would be the end for him. He feared that when families were removed from visitation, that the staff would bring it in. Well, on Wednesday, we were once again told that by the doctors that COVID was in Pops' nursing home. So we called again there to ask, is there any COVID in the facility? And once again, we were told no. There is none. Who told you that there was? Then Thursday, April 2nd, the call. To my husband from the ICU doctor, your father had a bad night, and unfortunately his COVID test came back positive. At this point, the decision had already been made to remove Pops from the ventilator, that if there was even the slim chance that he beat COVID, he would never be the same. We lost him just a few short hours later, as a nurse held the phone to his ear while his grandchildren, my husband and I, were saying goodbye. A blessing to be with him during his last moments. Not at all the way any loved one should ever have to die without family members by their side. COVID has taken this away from far too many families. In the building, still no COVID. How could this be? What went wrong? What steps were missed? How have we lost over 2,500 lives in our nursing homes due to COVID? How have we had over 30,000 cases in our nursing homes? When as of June 3rd, we had 42,201 cases in Connecticut, 4,007 deaths, and 30,026 of those deaths were in our nursing homes. That is 63% of the total deaths in Connecticut were in our nursing homes, where our elderly go to be safe and be taken care of. In the nursing home my father-in-law was in, they had 160 beds, 127 cases. They had, of that date, 41 deaths, not including my father-in-law, and not including Patty, a devoted staff that also lost her life due to COVID. This is why I stand in front of you all today. This is why my colleagues are here. This is why our governor is here. This is why on April 22nd, I wrote a letter to the governor addressing 17 items at that point I felt then went wrong or could have been done differently. This is why I asked for a statewide investigation of all nursing homes in the state. This is why a group of incredible women started working on the issue. This is why I commend the governor for his investigation of the nursing homes statewide. We must recognize that there were outcomes that varied from no COVID cases in nursing homes to nursing homes being almost 100% COVID positive. We must do better. We have developed a comprehensive list to be shared here and with the governor, hoping that when the investigation moves forward, these items will be considered for review. We also recognize that this investigation is not the end to addressing the crisis in nursing homes, but just the beginning. We have a lot of work to do, and I vow to not stop that work until changes are made. We have workers that have not had appropriate PPE. Hours have been grueling. That was even before COVID. Staffing ratios are unacceptable. Testing was not taking place. Reporting was not taking place. Residents were not allowed out of their rooms for weeks and did not have access to speak to their family members for just as long. And last night I had learned that some nursing homes just started to allow an outdoor visit. I could not imagine being unable to see my loved one for all of those months. We must do better. In closing, I just want to thank all of my colleagues that are here today and those who could not be, in standing with our residents to say we will do better. I will continue to pray for all of the families like mine who have been devastated by COVID and pray that we will not see the likes of this again. We all deserve dignity and respect to be treated with patience and kindness, and especially in our later years or when we are recovering from an illness or an injury. This is why we stand here today, to ensure that all of the popses in the world are given the best possible care at all times. Thank you very much for your time. I would now like to take a minute to introduce our governor, Ned Lamont, and thank the governor for being here and for your leadership in this area. Thank you, Governor.
Well, first of all, Michelle, we, in our own way, we all feel your loss and what Pops meant to you, and we all have a Pops. And as I've talked to some of my fellow governors, they said something interesting. They said, I think the people of Connecticut are wearing the mask and taking this a little more seriously than they are in some of the other states. For example, down south. Maybe down there they didn't necessarily know a Pops or somebody who had been hit and killed by COVID. We do here, and that's why we're serious as we are. And Rosa and Dorinda, I thank you so much for inviting me and letting me crash your caucus, the Women's Bipartisan Caucus. I appreciate the word bipartisan. I think, as you point out, there's nothing partisan about this, and our response has been together, unified as a state, and I think that's incredible. And I was reading an article recently about the difference between female leaders and male leaders when it came to the response to COVID. Angela Merkel and Boris Johnson in Britain, very different responses, very different results. Let me just say something else. Connecticut was hit really hard by COVID. We were hit because we are right next to the epicenter, that greater New York metropolitan area, where so many of our fatalities hit early. Our fatalities were also, we have a broad definition of COVID-related fatalities. We're going to see where all that measures out over the next few months. But really, we're an older population, and we're also a state where you're much more likely to have someone in a nursing home than just about any other state in the country. I think it's the sixth most likely to be in a nursing home. And that's why we've investigated these nursing homes, physically investigated them, several times. We've tested now, every single person at the nursing homes. We're going to be doing this on a weekly basis. But more importantly, that's why we're doing this study, to make sure we can learn, make sure that there's a second wave, we get this right. Our initial inspections are sort of interesting in some ways. I mean, there are, say, 20% of the nursing homes where there were no infections. And there were many nursing homes where a vast majority were infected. And we're looking at that. Is that a matter of infection protocols? Is that a matter of dementia units where probably you had less likely to be able to wear the mask? Is that a matter of some luck? Is that a matter of who used the PPE and how they used it? Some are using twice as much PPE as others. This is all what we are going to be investigating going forward to make sure that if there is a second wave, I don't think later this summer, but later this fall, that we're ready, prepared, and more Pops have a better chance going forward. And more broadly, talking to Rosa, we're thinking about our nursing homes, talking broadly about our nursing homes. I've had a stay safe, stay at home. Those that stayed at home are much more likely to be safe. And we got to think about nursing homes going forward, and what's the best place for grandma and grandpa, and where should they be? And should we make it easier for folks to stay at home and have the home health care they need? Should nursing homes be more focused on acute care going forward? This is all part of what our study is going to be analyzing, and it's going to be done in time to make sure that if there is a second wave, we're ready for it. And we do everything we can to keep Pops and everybody like them alive. Thank you, everybody.
Thank you very much, Governor. We look forward to all the work that you will continue to do around nursing homes. I also want to thank Representative Cook for sharing her emotional story. It's a sobering, sad reminder that every single one of those 2,500 lives were in similar situations and had family and loved ones that felt helpless, and were trying to make sense of it all and care, and we're going to do the work to make sure they get some answers. I noticed that Senator Looney has arrived, and I would like to give him the opportunity to say a few words as well.
Thank you, Representative Boer, and thank you for the invitation to be here today. As the Governor and Representative Cook said, this has been a tremendous and painful tragedy for the state of Connecticut, what we have lived through since the month of March. And we need to be better prepared for what we might see in November, should there be a second wave. One of the painful parts of this crisis was that one of the necessary measures on one side probably caused more pain on the other, and that is the ban on visitors that needed to be undertaken for public health reasons and safety. But at the same time, we all know, at least in my experience in visiting people in nursing homes over the years, both family and friends, it always seemed to me that those who had the most visitors got the best care, because those visitors, the family members and friends who would come in, would be the ones to be most vigilant in terms of pointing out inadequacies of care, pointing it out to the staff, or pointing it out perhaps in a more formal way with a complaint to the Department of Public Health. That element, of course, has been missing since March, and arguably it had to be. But it's one of the great challenges that we face. So I think that, and it is true also, as the Governor said, there's been a great disparity between a major impact in some places and a minor impact in other homes. We saw the example of one home in Bristol, I believe, where the owner took it upon himself to offer to have his employees who were willing to do so live in trailers in the parking lot of the nursing home, and not interact with their own families and be, in effect, quarantined with the patients. And that facility was very successful in avoiding the virus, but at the same time, there was a tremendous cost to doing that. So we need, I think, to be aware of, again, just the disproportionate number of elderly people in nursing homes. 63 or 64% of the deaths were in that category. And we need fundamentally to make sure that we have better procedures in place by the time the second wave comes. I think we have to, for safety's sake, assume that it will come, rather than just speculate about that. And I applaud the Governor for setting up the study that he's talking about, but I think the legislature also is looking to do the same in terms of our Public Health Committee and other committees of cognizance as well. It is a very strong priority for our Democratic Senate caucus, because every one of us in each of the districts in the state have dealt with this, either knowing someone personally who died from COVID, especially in a nursing home, or struggling and grieving with the families who suffered a loss. So I want to thank Representative Boer and others for convening this here today, commend the Governor for his commitment going forward, and certainly you have mine and that of all of the members of our caucus to do everything possible to make sure that we are in a better position a few months from now than we were a few months ago. Thank you.
Thank you, Senator Looney. And just two final points. There is a list of recommendations for areas to be reviewed that Christina, raise your hand. She has that list. If anybody would like to have a copy of that list to see the work that the Women's Caucus, the Women's Bipartisan Caucus Work Group has conducted, and some of those findings through conversations and meetings and interviews. And then finally, we just want to collectively thank the Governor for all the work that you've done throughout this pandemic. It's the first opportunity we've really had to be together. We know it's been a very difficult, challenging position and time for all of us, and we want to let you know that collectively we are here to support you to do whatever we need to do to keep our state residents safe and healthy. And with that, we are concluding our press conference, and we want to thank you for your attendance. Yes. I'm going to bring Representative Cook up here because she typed them up.
Yes. No, this has to be collective. This has to be a well-rounded response and investigation, and that does not leave us out of that conversation. We need to know what our responses were as departments, as agencies, as well as what the responses were at our nursing home facilities. So, Paul, that's a tough question. So in our nursing home specifically, so he asked when they were actually acknowledging that there were that there were COVID cases. I've had calls since there have been incredible reporters that have reached out to my family. My husband, it is my husband's story. He lost his best friend, and so that was his story to tell. And after that story was told for the first time publicly, we had received multiple emails, phone calls, messages, and even as late as April 21st, by report of families to myself, they were still being told that there was no COVID in the nursing home my father-in-law was in. So that would have been 19 days after my father-in-law had lost his life.
So was there something that, and I took a real quick look at it, so I don't thought, is there any kind of recommendation to require nursing homes, assisted living facilities, to notify families when there's an outbreak, any kind of outbreak, whether it's influenza or a novel virus like this?
Yes, and one would have thought that that would have been happening before we stood here in front of you or before the pandemic had hit. Regardless of whether or not that is something that one would need to legislate, I believe that that would just be human kindness and compassion to notify family members that there were, that there is a pandemic, that there is a flu outbreak, that there is a COVID outbreak in a facility. Representative Abercrombie, who is an incredible chairwoman of our Human Caucus, our Human Services Committee, and a member of our Women's Caucus, could probably answer a little bit more on certain details of things, as she's been that chairman for 14 years, give or take. But I'm listening over here, and the answer is yes, they should have been notifying folks accordingly.
And should the exception reports, as they exist now, the
You want to come in?
for the Department of Public Health for these nursing are very funky. They're difficult to run. They have to search for everything separately. Should there be some sort of repository where families?
Yes, and I believe that that's part of the conversation that we should continue to have moving forward. Where the reporting was going, how you can look at it, what are the state statutes, what are the state protocols, what are the regulations. And as if you look at the list, as Christina has, it's cumbersome on the things that we have brought to the table to say, these are items that we've identified, maybe where things fell off, questions that we have, things that we believe need to be addressed. Infectious disease and protocol and reporting are listed on here. Governor, who's conducting the investigation?
We have an RFP out now for the outside analytical group that specializes in nursing homes, and they'll be looking at the nursing homes as well as the overall statewide response. We ought to have something back on that very soon. I believe so. Well, we regulate the nursing homes, and one of the things we'll look at is if they did anything that's in violation, they deserve a fine. If it's something that's chronic, they'll deserve something more severe. That's what we look at, and that's what DPH regulates.
Governor, you have your version on the second stage reopening, and you're talking about control of this outbreak and status on the nursing home population. We're still getting from leaders who are saying that this is all an overreaction, it's all overblown, you didn't have to do what you did. Can you respond to those folks again?
Yeah, tell that to Poppy's family. Go to an ICU unit. Go see what's happening in states that opened up pretty quickly and didn't maintain the right protocols. and tell me it was an overreaction. Thanks, everybody.